Hello, everyone. Welcome to another episode of Take Back My Brain. Today, I have with me Dr. Christy Sutton, and you're going to love this conversation. We're going to talk about all things gut health, Crohn's, colitis, celiac disease, whatever this conversation goes with gut health. You are absolutely going to love this. And she's also an expert in iron. And so I want to mention, and it'll be in the show notes too, that she has a new book coming out. And so we'll have to have her back on to chat about that too, about iron and the misnomers and misinformation and misdiagnosis around all of that. So I have a feeling today is going to be a day about being misdiagnosed a little bit. And, how do we navigate that in this crazy medical world? So Christy, thank you for coming on.
Thanks for having me.
Podcast. I love the fact you're here. I've heard you speak a couple times. The last time I think I was at Live It to Lead It a couple of years ago, and we had a great conversation about genetics and those kind of things. So I really appreciate your work and I have a lot of respect for what you're doing.
Awesome. Thank you.
Yeah.
Likewise.
Well, I would love to dive into, let's talk about gut health and kind of how you came to where you are in your life, because I know you've gone through a lot of health challenges, yourself and your family. So I would love to hear your story. And then I want to dive into all things gut.
Sure. Yeah. Well, let's see. I was formally diagnosed with Crohn's when I was 16 after having been admitted to the hospital for abdominal pain, and they thought I had appendicitis, which is a common misdiagnosis with Crohn's, because a lot of times the pain is in the right lower quadrant where the appendix is, and there's a lot of inflammation there. And so they went in to do surgery and they discovered, my appendix was fine, although they took that out anyways. But it was really the last foot of my small intestine, which was largely inflamed. And I even had a small fistula there. And so they took out the last foot of my small intestine and diagnosed me with Crohn's. And this was probably 1997. So there were not as many options as far as medical interventions, biological immune suppressants like there are now. So they put me on Azicol, which was a pretty standard, like NSAID type pharmaceutical. And it was minimally to moderately effective. I didn't get any counseling about diet or nutrition or anything. They discussed getting some occasional B12 shots because the last foot of my small intestine, the last foot of the small intestine is where B12 is absorbed.
Right.
Bile is also absorbed there. So I've had lots of issues since then because I'm missing the last foot of my small intestine. I think now that's one of the biggest health challenges I have, that I just have to kind of manage every day of my life.
You're going to have to navigate that forever.
Yeah. And we can talk more about that, because that's kind of an interesting, unique, and commonly overlooked kind of facet to digestive health. But so then I was in high school, and I graduated high school and went to college. And by this point in time, my life was not going in the direction I wanted. I was determined to figure out why I was having all these issues. That didn't go how I desired. But it did lead me towards a doctor in Austin, a chiropractor in Austin, actually, who helped me figure out that I had pellagra, which is vitamin B3 deficiency.
Yeah.
Which is common, it's common for people with digestive issues, especially Crohn's, to have nutritional malabsorption. But so because I had pellagra, I was having chronic diarrhea. And so around the time I was 20, prior to meeting, his name's Dr. Bandy, he's a chiropractor in Austin. Prior to meeting him, I weighed 70 some odd pounds and was just like emaciated because I was having just this chronic diarrhea. Despite, eating a really clean diet, I had already figured out there were certain food triggers, gluten, dairy, those type of things. There was not a lot of great information out at that point in time. Probably the best book was kind of the Ending the Vicious Cycle book, which a lot of people are familiar with. It's, I think, somewhat stood the test of time, but quite revolutionary at the time, 20 some odd years ago. And so I, got off of the grains and stuff, but then was still having these digestive issues. And that's because I had pellagra. And so
Mm-hmm.
then I started taking vitamin B3, which is niacin, and, my diarrhea stopped, and I gained weight back, and it was, a process to rebuild my health. And I have learned many other things since then that have kind of helped me as far as digestion goes. But that was a big turning point because it kind of was a big introduction to how a simple but really accurate therapy and diagnosis can be revolutionary and life-changing,
Right. Right.
and how really, like, something so simple as a vitamin deficiency, it can go overlooked very easily. And I come from a very allopathic, traditional medical family, so we had all, access to all doctors and medical
Mm-hmm.
everything. My father is a medical doctor and pharmacist. My mom was a pharmacist, so I
Gotcha.
was given lots of antibiotics, and
Right.
it
Right.
was all about, oh, you have digestive problems, you need more antibiotics, which was
Mm-hmm.
probably like the worst thing
The worst
possible.
thing for you. Yeah.
Right. And then so one thing led to another, and then I, became a chiropractor, and have continued to learn as much as I can. And when I dove into the genetic piece, I realized, oh, I have a celiac gene,
Mm-hmm.
which honestly, I think just about every single Crohn's patient has one that
I
I've
think
seen
you're
so
right. Yeah.
far.
Mm-hmm.
Yeah. Not everybody that has a celiac gene will have Crohn's, but just about every Crohn's patient, with the exception of one who was an anomaly, um, will have a celiac gene.
Gene. Yeah.
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 Very interesting. So how did they test you for vitamin B3? I know people are going to want to know that. Like,
Yeah,
how do
so, well, Dr. Bandy is an AK doctor. I am too. And so he's been in practice for a long time, has a lot of experience, and had seen pellagra in multiple Crohn's patients at that point in time. And so
Sure.
there wasn't a blood test or anything. A lot of it was, what he had seen, his experience, and then he does AK, applied kinesiology muscle testing.
Gotcha.
So that was basically that. And I mean, B3 is very safe. So
Mm-hmm.
it's not like
Absolutely.
there was a lot of downside effect to trying it.
Mm-hmm. Yeah. And it was completely life-changing for you.
It was, and it really kind of clued me into, like, the environmental.
Mm-hmm.
It's not me necessarily this is broken, as I had kind of begun to feel like I was just broken.
Broken. Yeah.
And I realized, like, okay, it's not just like I'm broken, there's an environmental thing that is causing me to be this way.
Mm-hmm.
And getting the proper diagnosis and treatment really shows it's not me that's broken, it's just
Right.
I
And
didn't have
that
what I
is so,
needed.
so key, Dr. Christy, because you have so many, patients, clients that come where they're like, they're so hopeless because they feel like, what am I doing wrong? What am I doing wrong? And why is this not getting fixed? And sometimes, as much as we try, even as practitioners, it can be, something as simple as B3 and it does go overlooked. So
Often.
it's great to make people aware of that. I know with every digestive case that we have, like B vitamins are so, so, so important because if you can't absorb them in your digestive tract, like you can't, missing a piece of your small intestine, it makes a big difference.
Yeah. And I think, like, it's important to know that I don't think it's so simple as give people with Crohn's vitamin D3 and, like,
Right.
their problems are solved. There are a lot of other things that you have to have in place,
Multifactorial.
like, the right diet. For me, it's been really important for me to pretty much daily take probiotics, and I take something called GI Complete, which is just a powder that has, glutamine and marshmallow root and, saw palmetto. It's nothing revolutionary. It just has kind of leaky gut type gut mucosal stuff in it. So, and then the bile thing has been huge,
Yeah.
because I actually went through a period of time, especially after my pregnancy. It was interesting. During my pregnancy, um, I had previously, prior to being pregnant, had, like, periodic diarrhea, which I now know was from bile and
Mm-hmm.
bile not being absorbed properly. But during my pregnancy, that went away because during pregnancy, you don't make as much bile often. It's one reason that a lot of pregnant women end up getting like gallstones and
Right.
gallbladder removal after pregnancy. Their gallbladder just gets sludgy. And so then after pregnancy, I had like this rebound where my body made all this bile and I couldn't absorb it. And I didn't realize like I was having all of this diarrhea from bile, because bile, if you don't absorb it in that last foot of your small intestine, it becomes a laxative in your colon. And then you develop, bile diarrhea, which is like kind of this real urgent. Bile is like a yellowy color, and it often goes undiagnosed or improperly diagnosed, which I see that with Crohn's patients that have the last foot of their small intestine removed often, or even sometimes people that are taking bile supplements, like they'll be taking too much bile, or sometimes people that have had their gallbladder removed, they'll have bile diarrhea because their body's not quite able to like regulate the amount of bile removed. So bile diarrhea often gets missed, but I had to take something to bind the bile, because if I didn't bind it, then it was going to go to my colon and cause diarrhea, and that wasn't going to work. So I thought I was so smart when I figured out, oh, I can take calcium to bind the bile, because calcium binds bile. And then I did that for a while, and then I became so horribly anemic and like I couldn't get out of it, because the calcium also binds to iron. So like it didn't matter how much iron I was like consuming, I couldn't absorb it because the calcium was just binding to it. So I had to find another way. And so my gastroenterologist prescribed me cholesterol, which is a bile sequestrant. And at first he gave me the pill form of that, and that I couldn't take because the pill form had some type of like a binder in it that created lower quadrant pain, like, which I couldn't take that. There's something in that pill that, pharmaceutical companies like to put all sorts of junk in these pills. And so I developed a lot of right lower quadrant pain from taking that pill. Thankfully, they had a powder. So I took the powder, which didn't have that like whatever chemical. And I haven't had that right lower quadrant pain with it. And I've been doing that for years. And now I just manage the side effects, of which there are many, like, because if you are binding up the bile to prevent diarrhea, because you don't have the last foot of your small intestine, well, you're also not going to be absorbing like fats as well, fat soluble vitamins, cholesterol, all of these things. It's quite, I just have to walk this fine line, and it gets exhausting, but that's where I am.
That's where you are, because you can't change that, right? Once it's gone, it's gone. So it's always quite a miracle, actually, what you're walking out.
And it's really like, I have learned that I have to manage it, because I feel like there's really, part of it is that, I live in my body and I know it very well, but I also have studied a lot and know a fair amount about health. But it's really hard for me to like have a doctor manage it for me, because I just don't think a lot of people understand all of these caveats. And so I pretty much have to just like go to them and say, order these labs and order this, give me this. And they usually do it for me. And I've seen that with my Crohn's patients, like, their doctor's not talking to them about, oh, you're taking a bile sequestrant, make sure you're taking, fat soluble vitamins and all that. So it's just, you got to be your own advocate.
You do, because there could be so many missing pieces and so many opportunities to have a misdiagnosis.
And it's, I think, becoming even more common, unfortunately, while we have access to all of this testing. And I don't know what AI is going to do. That could be good, could be bad, could be both. Likely it will be both. But the problem is that doctors don't have time to spend with people, is part of the problem. And it's not really fair, because they're somewhat handcuffed by the insurance companies and what the insurance companies will allow them to order. And, I believe a large part of their, scope is pharmaceuticals and surgery. And so, they know those very well for the most part. But what they haven't quite learned as much about, which I hope improves in the future, is learning about some of the preventative nutritional, finding the triggers, stuff like that. But that takes time. And, if insurance companies aren't running the tests, or if, there's no financial benefit to going down that route, then this is where patients often kind of fall through the holes.
Right. And then they end up in multiple medications and never really get the answers they need to boost their immune system and all those types of things. Yeah.
Right. And then this whole compartmentalization of health, where it's like, okay, my gastroenterologist, even though he's prescribing, a cholesterol lowering bile sequestrant, which I'm not taking it for high cholesterol, I'm taking it to lower, buying the bile, he can't order, a cholesterol panel on me.
Which doesn't make sense.
Right. Yeah. And then it's like, if I talk to him about how, it would be nice to get a food allergy panel run through insurance, it's like, I can send you to an immunologist, but it won't matter. This is literally what came out of his mouth. I can send you to, an not an immunologist, an allergist, and they can order that, but it won't make any difference for your Crohn's. It's like, okay.
But it does make a difference, because you and I know that, because we see that all the time. And so I think that's so important. So let's talk about that, like food allergies, celiac disease, and how that contributes to, say, Crohn's and ulcerative colitis and those types of things. Because most of the time, like you're saying, unless you have an anomaly, which I recently had as well, I had a young lady who had ulcerative colitis, and generally speaking, I see people who have celiac genetics when they have that, and she didn't have any. So then you're like, is it a misdiagnosis? Was there something else going on? So I would love to dive into that, genetically, what does that look like for people who have all these digestive issues, but they're never tested for celiac?
Well, unfortunately, that's more common than people being tested for celiac disease. And, testing for celiac disease entails you have to be eating gluten. You have to either get some blood tests that look for the antibodies, specific antibodies. And not everybody that has celiac disease is going to test positive.
Yeah.
And so that's a big problem. It's common for people to say, oh, they tested me for that and I didn't have it. And then I'm like, well, can you show me what they actually tested you for? And maybe they didn't run all of the tests they needed to. Or maybe they didn't check you for also maybe gluten sensitivity, which is also not celiac disease, but headed in that direction, and the treatment is a gluten-free diet. Or, maybe they didn't check you for like a wheat allergy, which also, can be handled with a gluten-free diet and create a lot of the same problems. I have, with getting more into the genetic testing over the last several years, now my favorite just beginning test is, do you have a celiac gene?
Yep.
If you have a celiac gene, then you're at a high risk for developing celiac disease. Everybody who gets celiac disease has a celiac gene. Not everybody with a celiac gene gets celiac disease, but a much larger percent of people that have a celiac gene get celiac disease than we're really giving credit to, because celiac disease is so poorly diagnosed, and it often is not digestive at all. It can often just, affect your nervous system and create, inflammation in your brain, which could look like ALS, or, it could look like schizophrenia or bipolar or depression or, whatever. So diagnosing celiac disease, in my opinion, if I see somebody with that celiac gene, then I talk to them about what celiac disease can look like and what symptoms it can cause. And if they have any of those symptoms, why don't you just try a gluten-free diet for X amount of weeks and then see how you do? And almost every time they feel much better off of gluten, and then when they add it back, they feel much worse. And it's not just because like they're getting rid of some of the processed foods, like they have serious immunological consequences, like massive changes in weight, because like a lot of people think if you have celiac disease, you get all like emaciated and
Right.
lose weight. A lot of times people lose weight when they go on a gluten-free diet if they have
Right.
celiac disease, because they lose it fast because
Yep.
it's water weight, it's inflammation. And then if they go eat gluten, they gain like 5 or 10 pounds. And it's like, that is not normal weight gain. Like that is inflammation. This is bad. So, it can just look about like just about anything. But unfortunately, I don't think most doctors are looking for the celiac genes. In fact, I know they aren't. And I know that most people don't fully understand how important they are and what it can look like, because a family history of celiac disease, you're going to see a lot of inflammatory bowel disease in some cases, but you could also see like mental illness. You could see type 1 diabetes, you could see rheumatoid arthritis, Hashimoto's, lupus, pretty much any autoimmune disease.
Yep.
Because celiac disease,
higher incidence of cancer.
higher, yeah, oftentimes people, especially gastric cancer, like if you see a stomach cancer, like if you see a celiac patient and they maybe lost like a parent or a grandparent to stomach cancer, my guess is that they got their celiac gene from that person. And in some cases, it's hard to know. Like for me personally, I indirectly figured out I inherited my celiac gene from my mother because I got my father tested and he didn't have the gene. And so I know I got it from my mom. I already kind of knew I got it from my mom because I treat some of my relatives that had that gene, which is a somewhat like there's 2 celiac genes. I have a kind of more rare one, HLA-DQ8, and that's just only about 10% of the population has that. So like the chances that me and my family member had that, it's like, okay, I got this from my mom. Anyways, my mom was never diagnosed with celiac disease, but she had horrible mental illness and died ultimately from mental illness. Wow. She also had diabetes, which I believe was type 1 diabetes, but not properly diagnosed, which also happens a lot. She was, even when she was thin, she had diabetes. She had to take insulin. This is very possible. There's no way for me to prove it. But you see this family history and, it's so heartbreaking because the treatment can be so simple, but oftentimes the people who need it the most are mentally ill and like they can't even put themselves on a gluten-free diet.
Right. Which, that's the heartbreaking part of it. And I love what you're saying, like it shows up differently. So myself and both of my kids have the celiac genetics. And so I was diagnosed with that, when I was like 22, I had a lot of digestive issues. I was, 12 years into an eating disorder. I had a lot of anxiety, depression, and thankfully I went to a practitioner who actually tested me. And she's like, oh, you've got celiac. And so mine looks completely different. Like I get really constipated. When I went on a gluten-free diet, like what you're saying, and I wasn't a big person, but I lost like 20 pounds. And just like that, people thought that my eating disorder was like out of control because I lost weight so fast, but it was just inflammation. And then, my son, who's now 25, when he gets in contact with even, and he has a corn issue as well. So anything that will trigger celiac plus the corn, right? Everything in his body hurts and he feels really weird in his head and he'll get kind of like giddy and like just kind of out of it. And then my daughter's completely different. And so, you have all these different reactions. And my mom, I know she had celiac. She never would let me test her for it, but she had over 40 surgeries. And, at that time, she was one of the first Roux-en-Ys in the country that was done at Mayo Clinic. And so, had we been able to put her on a gluten-free diet at that time, probably would have saved like, 35 of those surgeries for her, and then she died of dementia and Alzheimer's because it was just such a mess and she was mentally ill.
And malabsorption and inflammation.
Like she couldn't digest anything. She was missing, almost all of her small intestine, except for the last piece of it. She's missing half her stomach, so that took out pretty much all her ability to absorb most things. And so there was no way that we could nourish her. There just wasn't. It was very minimal. And you just kept seeing this decline. And all that anesthesia, and her brain just was like, I give up kind of thing. So when you're talking about this, it does look so different in really each and every person. And so I think that's a big myth that people think, well, I don't have any digestive issues, so therefore, I don't have any issues with gluten or wheat or, any of those kind of things. So I love the fact you're bringing that up.
Also, kids on the spectrum.
Yes.
I have yet to see an autistic child that doesn't have a celiac gene.
Yep, I agree.
And I'm sure there are some out there, but I haven't seen them yet.
Mm-hmm.
So, and if a lot of people don't understand that celiac disease is an autoimmune disease. Like, I know you get that, and I'm sure a lot of your very educated
listeners
audience
do, yeah.
know that.
Mm-hmm.
But a lot of people don't know that. A lot of people don't even really know what celiac disease is. Some people don't even really fully understand what gluten is,
Mm-hmm.
but celiac disease is an autoimmune disease, meaning that it's triggered by eating gluten. But what happens when you eat gluten is your immune system starts attacking your own body, whether it's your thyroid and you call it Hashimoto's, or your intestines and you call it IBD, Crohn's, colitis, or your joints and you call it rheumatoid arthritis or lupus, or name the tissue, or your myelin sheaths and you get multiple sclerosis.
Mm-hmm.
It is an autoimmune disease that triggers other autoimmune diseases, because once you have one autoimmune disease, then your immune system has lost tolerance.
Yes.
And that tolerance is not going to be found if you continue to expose your body to what's triggering that autoimmune disease. And so with celiac disease, gluten is the trigger.
Mm-hmm.
But autoimmune diseases can be triggered by things other than gluten.
Right.
So they can, other than foods. But with celiac disease, you often see this family history of lots of autoimmune diseases, because what is every generation doing? They're all eating more or less the same foods. They're all eating gluten.
Right.
But there are other triggers, and maybe like your anomaly patient had a different trigger, like a mold trigger or a viral bacterial infectious trigger.
Yeah, we think she had a parasite trigger, actually.
Yeah, because, there are things, whether it's, stress or mold or an infection or food or heavy metal toxicity, chemical toxicity, there are things that drive your immune system and stimulate your immune system. Vaccines can do it. This is why there are some people that develop autoimmune diseases after getting vaccines. I'm not saying that to be controversial. It's in PubMed.
Just is.
It is what it is.
Yep.
And so these triggers have to be identified. I think celiac disease is one of the easiest ones to identify, because we have a gene. We have an easy test, which is eliminate gluten. There's more tests that we can and do talk about, but it's as simple as it gets as far as triggers, because triggers can be really hard. Infections can be hard to track down and get rid of. Mold is a nightmare. I personally have dealt with that myself. Living in a house that had mold, and I had like this huge Crohn's flare up, and I'm like, I never had a flare up like this in my life. I've had Crohn's disease for decades, and I have been fine. And then all of a sudden I have this flare up, and it took me a while to figure out why. But then once, I did the mold test, the mycotoxins test, my ochratoxin was very high. And then, did some things to get it out of the house, air out the house, fix a couple things, retest, and my pain goes away and my ochratoxin's low, down to 0 basically. And so it's just, there's so many triggers, and so many of them are hard to diagnose and treat. Celiac is not, but the diagnosis rate is abysmal. It's like 1 in 10. Right. 1 in 10 is diagnosed properly. Actually, I think it might even be less than that, but it's way lower than it should be. And the most people that do have it, it takes like decades before they get diagnosed. So, you are really like on the cusp of being at the forefront of this. And if we could just get this one thing, like Italy I haven't been to Italy recently, but my colleague has gone there recently and she cannot eat gluten, so she's very aware.
Mhm.
And she said that she learned when she went there most recently that they have decided to test everybody at the age of 10 for celiac disease
That's
because,
amazing.
well, they have a healthcare system that is not designed to just bleed the public dry. They're actually trying to like
Be
save
proactive.
money. Yeah.
Mhm.
I'm not saying there aren't problems with socialized
Yes.
medicine and all that, but we have our problems too. So they saw all these people that were having issues with digestive issues. They tested everybody. They decided at the age of 10, we test everybody for celiac disease. The diagnosis rate went up. And now you basically have a gluten-free option anywhere. They have this numbering system in the restaurants, and it's in basically the laws. You
Nice.
have to have some type of gluten-free option. And so it was there. Celiac disease was always there. It just wasn't being diagnosed.
Mm-hmm.
We have it here too. We have a huge celiac population here.
Right.
It's just not being diagnosed.
Why do you think that is? Like, it feels like it's almost like they're against diagnosing those types of things. And I know when I got diagnosed, gosh, that was in 1997. So I mean, it's been 1996. I mean, it's been a bit since I got diagnosed, and it was really unpopular back then. And so when you tell people that I have celiac and I have to avoid, XYZ, people would lie to me all the time and tell me that it was clean food and that they made it specifically for me, and it wasn't, even family members
Yeah.
navigating all of that. But it's sort of like the community as a whole. I mean, it's getting more awareness, but it's still sort of taboo to get the diagnosis or to even acknowledge that it exists. Sort of like, Hashimoto's is sort of on the same line as that too. Like, why would we ever test for that? Because, it's not going to make a difference or anything like that. So what are your thoughts on that? Like, it just feels so, let's not talk about it.
Yeah, I see that. I agree with you. And I have my thoughts as to my hypotheses as to why that is. And I'll be happy to share those with you.
Yeah.
I think part of it is, and genetic testing is going to help change this, just not fast
Yes.
enough, it appears. Um, when like my father went to medical school, they were teaching like celiac disease is extremely rare. You will probably never see it in your life. And then with genetic testing, you realize like, oh, 20 to 30% of the population has this gene.
At least,
And
yeah.
in my opinion, most of those people have a gluten problem, whether it's gluten sensitivity, a wheat allergy, full-blown celiac disease, something along that. Like, I know I have celiac disease because
Mhm.
if I eat gluten, my life is destroyed.
Right. I get it.
And in fact, I have never been formally diagnosed with celiac disease because that would require me to eat gluten and do the test. And if I ate gluten for 2 weeks to do the test, my life would be destroyed. I
Right.
would not be able to work for a month. I would probably have permanent damage and end up in the hospital. I can't do it.
Right.
My daughter, at the age of 4, developed stomach pain, and I have a very low threshold for that with my history. And so we did, I assumed that she was going to have a problem with gluten just because she's my daughter. I gave her a
Yeah.
celiac gene, but I wanted to have the paper to show my husband, my relatives,
Right.
I'm taking my 4-year-old off of gluten. And it's not because,
Not
I'm,
because you're crazy.
it's
It's
not because I'm
because, right.
crazy. It's because the paper's telling me to, and I'm just following directions.
Right.
And, I did the labs. She didn't have celiac disease. She just had gluten sensitivity
Mm-hmm.
and a mild wheat allergy. So I did those labs, took her off of gluten, stomach pain went away. She is a 4-year-old. So whether it's her own intention or like misguidance from maybe her father, she has tried gluten since then.
Sure.
And it didn't go well. And my job at that point in time was to connect the dots, not to get mad at her, but say, you are having this problem, this stomach pain because of what you ate. It's
Mm-hmm.
because it has gluten. I'm sorry, I have that problem too. And I know it's hard, but it's much easier than eating gluten and being sick and having to deal with those health problems.
Yeah.
And now she's really good. Now she's 10. She's really good about choosing to eat gluten-free. It can be challenging, I mean, even me as an adult, it's not as much for me now, but certainly, not even like probably like 10 years ago, I remember, especially when I felt like my certain family members were kind of like not being supportive of it. Like,
Right.
it's Thanksgiving, and I've had this problem for decades, like, or at least a decade, and like, you can't figure out how to make that gluten-free.
Yeah, I know.
And like, it just, sometimes it just feels so isolating,
Yeah, it does.
But what I have found is that, like, the people who really love me, they're going to find a way to make sure I have something to eat. You know what I'm saying?
Yeah.
And I also got really good about, like, I will make sure I can bring something that I can eat. And, so I always make sure that, there's something I can eat. But that can be emotional. And so I'm going to circle back around to your question, because it's a good question. But why is there a taboo to diagnosing this disease? Part of it, I think, is that people don't want to change their diet. They are scared. They're scared of being ostracized, of not being able to do their normal things they like to do. They don't realize how bad they truly feel, because they're not, and we also live in this world where there's like, most of the treatments out there are symptom suppressing rather than getting to the root cause of the problem. So this is not a medical system that's designed to get to the root problem, which celiac disease is a common root problem for a lot of people.
Right.
I also think that what I have seen is just a lack of knowledge and understanding in the medical community about celiac disease. Like, I think they need to maybe like do some good continuing education hours there. And unfortunately, that's just not where the mass medical profession is going right now. They're very much about treating things with pharmaceuticals, treating symptoms, suppressing the immune system if it's an autoimmune disease. They feel like they have succeeded if, your symptoms are okay as far as your autoimmune disease goes and your labs look okay. It's not looking further down the line at what could be avoiding. And if we circle back around to what you said about the Hashimoto's, Hashimoto's, which is an autoimmune disease that affects your thyroid, very common. I think it might be the most common autoimmune disease, although my guess is celiac is right up there.
Probably right up there.
Yeah. Because most people, a lot of people with Hashimoto's have a celiac gene, and celiac disease has been a trigger. So, but it is common myth that if you have Hashimoto's, why even run the test? It's not going to change what you're doing. If your thyroid's destroyed, we'll give you thyroid, who cares? And my thoughts on that are like, okay, maybe, yes, like if your thyroid's destroyed from Hashimoto's, they give you thyroid. In the world of autoimmune disease, like, that's not the worst case scenario. It's not like you like have Crohn's and they're cutting out part of your bowels or whatever. But like I said, if you don't figure out why you're having that autoimmune disease, then it's a matter of when, not if, you get the next one.
Exactly.
Okay.
Yeah.
So like, my dear friend, she's a PA, and she was telling me, her patient, he had his colon removed for colitis, and he's fine now. I said, yeah, we'll just wait until he gets the next autoimmune disease. She said, yeah, well, now he has autoimmune hepatitis. I'm like, well, what are they going to do? Remove his liver now? And I said, well, I bet he has the celiac gene. And she said, yeah, probably. And then apparently his mom had autoimmune diseases too. And it's like, but she is a very good clinician, but like, it's not standard procedure to run celiac testing on these patients. And that comes back to, a lot of these doctors are just following protocols rather than, what I think we're trying to do, which is really like navigate uncharted waters and create a personalized health plan
Yeah,
And that is something that is as much an art as a science.
absolutely. Just getting to that root cause, because there's so many, it's just multifactorial, right? And so, but I think what we're talking about today is such a key factor, and just giving people such great foundational stuff where they can go like, yes, okay, I have this. And so therefore I cannot, eat these things. And, and I think it makes people more conscious, more aware, but just like being more, what do I want to say? Diligent. I know some people who have celiac disease, but yet they're still like baking with gluten and, working in places that may have, wheat going on in the air and those types of things. And they're still sick. I mean, like, they're still having thyroid issues or arthritis issues or those types of things. And I don't really think, because they haven't been taught, that how serious like celiac disease really is. Because when you have celiac disease, your ability to absorb food is greatly compromised. And so whether you can not eat it, but if you're still exposed to it, you can still have a lot of the symptoms that never go away. And I don't really think people understand that.
They don't. Yeah. And I have, I don't know if you've taken my gut workshop, but I have a slide that has like all of the health problems that
Yeah.
are known to be associated with celiac disease. And that's, I think, an important thing for people to see. And because then you kind of look at it and you're like, I don't know if this is worth it actually. But some people, I think on the path to health, we all have a threshold of pain. And for some people, and that's where it's really important, like to help people connect the dots, and then they can ultimately make their own decisions. But it's like, I gave you the information. Whether you heard it and you internalized it and you followed it is another story. But I told you, you have this gene. These are the problems that are associated with it that you're having. These are the problems that are associated with it that are in your family history. This is what your future can look like. This is the treatment. This is extremely important. This is why. This is what it does. Nutritional deficiencies, inflammation, autoimmune diseases. And then, you just have to sometimes like keep explaining it. And sometimes people have to hear it multiple times. Sometimes they're not going to listen to the possibility because they haven't met their threshold of pain yet.
Sure. Absolutely.
And we all have different thresholds, and some people are more willing and able than others. And some people constantly find excuses, and, that is their own journey. So, but it's still hard to watch, especially personally, like believing that my mom's health could have been so much different mentally if she had been properly diagnosed and treated. And like I said, this is all theoretical because I have no way of proving this, right? She died before I could prove this. But I just see it enough where it's like, I see, and these are the hardest people, because once like your brain is affected in a way where you cannot make good choices, like getting on a gluten-free diet is too hard for you. You cannot do it.
Right.
This is why it's important to diagnose people when they're young. This is why we need to be checking kids. This is why the genetic testing, in my opinion, should be done at an early age for everybody. And anybody who has a gene should be monitored closely with labs. That in and of itself would catch a large percent of the population.
Yeah, and it's very preventative. Yeah,
very preventative. It would save us a fortune.
Mm-hmm.
It would save us a fortune.
Yes.
It would, but the medical system we live in is not designed to save $100,000 in 10 years, but cost $200 today.
Right.
It's very much about give you the diagnosis of the symptom, manage it with a drug, and refer you to a specialist.
Right. Yeah, this is so great, Christy. I really appreciate this. Like, what else do you want to tell people about celiac?
What I want to say is, in the gut workshop, I have the PubMed study that has this ALS patient who they do a workup and they realize that he actually has celiac disease, but he has all of the neurological testing, MRI findings that he is diagnosed with ALS.
Sure.
And then they realize, oh, he actually has celiac disease, and they put him on a gluten-free diet, and he's no longer diagnosed with ALS. He's better. His neurological testing.
And you don't ever recover from ALS, right? Because that's what you're told.
Right. But I believe that a lot of times ALS is a misdiagnosis as well. And I think, this PubMed study is an example of how, and this, not every ALS patient is a celiac patient, okay? It's like, there's always a trigger for something that is causing a health problem.
Yes.
And it's often environmental. So for example, this is a bit off topic, but I think also within the realm of what we're talking about. When I worked in Austin, there was a dentist, Dr. Nunnally, who was where was he? He was in, I can't remember where he was. He was close to Austin.
Okay.
And he, Marble Falls. And he was a dentist that spent much of his career putting in mercury fillings, taking out mercury fillings. And he was diagnosed with ALS. And then another dentist came to him and was like, hey, you might have mercury toxicity. A lot of us do, because we're exposed, we're highly exposed. And especially, this is like an older dentist. So there was a long period of time when, they would have it in their,
just mix it together.
This whole awareness of how mercury is really dangerous is a newfound thing within the last, couple decades. So he had this huge exposure, and then just even removing those fillings and putting them in, you get all this exposure. And so he, upon, this other dentist advising him, did some mercury toxicity testing. He was extremely toxic. He went through the whole detox protocol, doesn't have ALS today.
Amen.
He's back practicing, has a thriving, he's one of the most well sought after biological dentists, and he's, fully bought in because of his experience.
Right.
So it's another example of what is ALS. Is ALS just a misdiagnosis because we're missing something else that we need to find? I don't know. I do know that everybody needs to really be looking for, the root cause of their health problems. And that's easier said than done, but it is so important, more important now than ever.
Oh, I totally agree. And it's so important to get the right labs run. And, I'm so thankful that I can run labs for people, right? Because
it's so frustrating too, because insurance isn't paying for it.
Yeah. Insurance won't pay for it. And it's just,
you have to pay for it.
And most doctors won't work with you. And I understand why they don't, because they're in a system, and I understand that. It's just, their hands are tied, and then, your patients are tied, and your hands are tied. And so I'm just thankful, that you and I have the options of, ordering what we want to order for people for the most part. Right. There's some limitations there, but.
Right. But it is unfortunate, because in a way it's kind of I feel like there's this haves and have-nots system, and the people that, we are seeing are people that have the means to, although it is a huge undertaking for a lot of these people to, pay for these labs, pay for the clinician, pay for whatever the treatment is, whether it's, a certain diet or, having fillings removed or whatever, they have the means, physical, emotional, financial, to get to the bottom of it. And those, I believe, are the haves. And then, the have-nots are the people who are really kind of stuck in the insurance system because that's all that they can afford. And unfortunately, I think now with the internet and all the information, maybe they have a little bit more of a fighting chance, but there's so much bad information out there. It's how could you ever really sort through it all if you don't really have the experience and knowledge? It's, you need somebody to cut through all of this
Yeah. And that's why I love doing these podcasts, because, if people are actually searching, they can find out, this information and, do what they can when they can with, whatever they have. So yeah, it is a challenge because there's so many underserved people out there that I'm like, oh, I want to like cut into the system and like, let's do this, and this, and then so many more people will get well.
Well, and that's the beauty of this talk about if people just figure out if they have the celiac genes.
Yes.
If they just order a 23andMe or whatever other company that tests for the 2 celiac genes, and they just find out if they have that. And then they say, screw it, I can't even afford that, I'm just going to try a gluten-free diet.
Right. It's easy. Yeah. I mean, it's not easy to do, but it's doable. Yeah.
It's doable, but there's a lot of resistance. It does take that extra step. It does change your habits. Like we've been doing it for decades. So it's, it's an inconvenience, but it's not impossible.
Right.
A lot of people, like, they don't even know what gluten's in.
Yes. Yes.
It's and then they try, and then they're like, oh, that had gluten in it. Ooh, yeah. And it's sneaky. It gets into things, like fake crab meat. Go get some fake.
I know, right?
That fake crab meat.
Why does that have gluten in it? I was so disappointed when I found that out, years and years ago. Like, you gotta be kidding me. Not that I should be eating fake crab meat, but at the time, I was like, that sounds really good. And then you learn that, I can't have that. So,
or like soy sauce, or like, soup. You get soup and they put flour in it. And these are the tricky things that often, make it where people don't realize, oh, this diet may not be working because I'm actually still eating gluten. Yeah.
And, for some people who are super sensitive, even if they have gluten in the house or their spouse is eating gluten, and they're, your spouse kisses you after they've had, whatever they're eating, that can still affect a large percent of the population. So
yeah, that is so true. That I do think those people should consider taking those DPP4 enzymes to help break down a little bit of gluten, and then just doing things to really like heal up the gut. So that the immune system kind of taking probiotics to kind of like get their immune system to calm down.
Yeah, no, I totally agree with that. And, and it's even more challenging with kiddos, because they don't understand, and they'll go to other people's play houses and those kind of things. I remember my daughter was 4, she was at my mother-in-law's house, and all the cousins were home, and she had her own little drawer. Both my kids had their drawer at grandma's house that had their snacks in it, and but the drawer above it was the other snack drawer. And I was gone for a weekend, and I came home and I could just tell, I mean, she had the big dark circles under her eye, her belly was distended, and I said, sweetie, what did you do eat? She's like, nothing. And I knew darn well she did. Well, I found in her room, she had a little bag and she had like 13 Butterfinger wrappers in there, those little bun sizes, and so it's hard with kids, and it took us kind of weeks to get over that. And she was when she was little, she's like, when I'm 16, I'm eating wheat. And, now she's 17 and she would never touch it because, she understands now because she's grown up and we've explained it well, and she knows how she feels and how she doesn't feel. And, but it's a long process with kids. I think it's just easier for us adults. I mean, like I can go someplace and just not eat, but you can't take your 6-year-old out and you're like, oh, we're not eating because they don't have anything. Like you have to be super prepared and intentional.
Yeah, but that comes back to the whole connecting the dots. And so it is much easier as an adult to help your child be gluten-free.
Yeah.
If you're already gluten-free, then like an adult who doesn't know very much about being gluten-free that is now being told my child has to be gluten-free, like they haven't figured it out for themselves. Yeah, it's a lot. And often, the apple doesn't fall far from the tree. It's like, well, your child needs to be gluten-free because one of you guys need to be gluten-free too. And then it's like this whole kind of, and that's where it's like, this is more than we came in for. I don't know if this is going to work for us,
Right. Yeah.
And maybe you just planted the seed and that's their path. But as an adult who, has gone through being gluten-free and has a child that's successfully gluten-free, and what you just explained, You have to connect the dots for them. If you connect the dots, you feel this way because you ate this, then they will make better choices. But you also need to give them options. So like, I'm not a fan of a lot of the gluten-free stuff out there. Gluten-free brownies taste delicious. They're junk, but I'm going to let my child eat some of those things
Yep.
so that they don't feel like I'm constantly saying no.
No.
And I feel like I'm constantly saying no. And I am constantly saying no because 99% of the stuff out there is trash.
Right.
It's just that, unfortunately, that's the world we live in. And so, you know, you have to create opportunities where they get to have something. So like going to a birthday party, I would always make sure I brought a gluten-free dessert or a gluten-free pizza or whatever, you know. And it's great if a parent that's throwing the party thinks about it, but it's not really their job. Like, it's my job to make sure that they have something, because if this fails, you know, it's on me.
Yep.
So that's important. And then there was something else I wanted to say, but now I just totally forgot. Sorry.
That's okay. That's okay. This has been a phenomenal conversation. I think you and I could chat for a long time about this.
Yeah, it's so important.
It is so important. So any parting words that you want to share?
Oh, you know, I have the gut workshop at glutencurse.com. And I think if this is something people are interested in, that might be something worth looking at.
Awesome. Put that in the show
Because
notes.
you know, it gives you like actionable steps to take and kind of helps you really understand what it can look like as far as gluten sensitivity and all that.
Yeah.
But I think we covered it in pretty good detail today as far as just this topic is so important, and I just hope that more people get diagnosed, and maybe a couple people will figure it out off today.
Yeah, I hope so too. Awesome. Well, thank you so much, Dr. Christy, for being here. I've loved this conversation, and I know my audience has too. So I thank you all for listening, and I will see you in the next episode.